Hi, my name is Stephanie Rhodes. This is for the Mount Aloysius Health Assessment class. I'm going to be doing an assessment of the eyes, ears, nose, mouth, and throat. This is Emma. She is a one-day vaginal birth from 11:29 at 3:30 in the morning. Her mom is a Gravida 2 Pair 1. Her mom received all prenatal care, was on no medication besides a prenatal vitamin during her pregnancy. Mom is breastfeeding without any problems. Mom's blood type is O positive. Baby's blood type is A positive. However, the baby did have a positive Coombs. Cord blood was drawn on the infant, and the bilirubin was 2.1. The bilirubin is still trending upward. However, we're watching it. The baby had a hearing screen at 8 hours of age, and originally she had passed on the right side and referred on the left. They repeated the hearing screen at 12 hours of age, and she passed on both sides. Talking to mom's only concerns are that the infant appears to be cross-eyed at times. However, it resolves. And the mom's first child was born with a cleft lip and cleft palate. So we're going to start first with the eyes. Infant's eyes look symmetrical. There is no swelling, no edema. Let me put on some gloves. Sclera are clear, both sides. There's no redness. Irises are blue bilaterally. Color is clear. There's no haze. Conjunctiva is pale pink. There's no redness. Eye sockets feel good. There's no lumps. Visualize the eye. Pupils are equal, both reactive to light. I'm going to look at the cornea and check the red reflexes. Corneas are clear. Red reflexes are present. Cornea is clear on this side. Red reflex is also present. Next is the ears. Both ears are symmetrical. Cartilage is well formed on both ears. There's no lumps. Ears feel normal. Outer ear, the tragus looks fine. There's no drainage from the right ear. There's no drainage from the left ear. Use the otoscope. Look into the side. Tympanic membrane is gray, pearly. There's no swelling, no redness. Next ear. Same thing on this side. Tympanic membrane is gray. No swelling, nothing visualized in the ear canal. The infant passed its hearing screen on the second time around. The first time, what could have caused the infant not to pass the hearing screen would be leftover fluid from the birth that hadn't had a chance to drain out yet. Or not being properly hooked up to the hearing machine can also cause the infant to not pass the first time. Next is inspection of the nose. Nose is midline, symmetrical, feels good. There's no drainage coming out of the nose. I'm going to check for patency by occluding the right nostril and then occluding the left nostril while closing the infant's mouth so they're forced to breathe through their nose. Next, I'm going to look at the infant's nose. Septum looks good. There's no inflammation. Mucosa is pale pink on the right. On the left, same thing. Pale pink, no drainage. Sinuses are present in an infant, however they're really small, so there's no need to palpate or visualize them with a flashlight. Next is the mouth. Lips are pink, moist, symmetrical. When the infant cries symmetrical. When looking at her gums are pink, moist. I'm going to feel for teeth. There's no teeth in the gums. I'm going to feel the palate. There's no opening in the palate. Infant has a good suck. I'm going to check her gag reflex by sticking my finger towards the back of her mouth. She does have a gag reflex. Next, I'm going to visualize the back of her throat. Everything looks good. It's pale pink. There's no swelling, nothing occluding the back of her throat. I'm going to lift up on her tongue to check her frenulum. Some infants are born tongue-tied and have to have a frenulectomy. However, her tongue has enough give to be able to come out for proper breastfeeding. This is a normal newborn assessment of the eyes, ears, nose, mouth, and throat. Some teaching that can happen for mom and dad. We can educate them about the hearing screen, on why the infant didn't pass the hearing screen the first time because of that extra fluid that built up. Sometimes infants just need a little bit more time, or could have been a malfunction with the equipment. Next, due to the mother's blood type and the baby's blood type, also the baby breastfeeding and the gestation of the baby being 37 weeks, this infant is at risk for jaundice. We can educate mom and dad that with the yellow hue that the babies will get with jaundice, they'll also notice that the sclera will also become yellow. The gum line can also become yellow as well, for signs for them to look for places to look for jaundice. With mom's concern about the infant being cross-eyed, infant's eye exam looks perfectly normal. So what we would educate the mom on is it's normal for infants to appear cross-eyed due to the weakening eye muscles until between 2 and 4 months of age. That should resolve. If it doesn't resolve by then we'll have to look into a specialist to take a look at the baby. And some other things that we could educate mom on is infants see bright colors and moving objects until about 6 weeks of age, whenever they develop binocular vision. They also will start developing teeth between 4 and 6 months of age. However, every baby is different. And that concludes my eyes, ears, nose, and throat assessment of the infant. Thank you.